5 minutes of the game, I went to tackle one of the girls, and my teammate also came in to tackle her, and me and my teammate actually hit heads.
You had a headache, sensitivity to light.
Yeah.
Yes, you have a mild concussion.
I figured. Ooh. Oh, I feel great.
All right, let's talk about it. Is everything okay?
Everything's great.
Okay.
Now.
All right, tell me about it.
So I've been playing rugby for 7 years, and 7 years I've gone without a facial injury. And for some reason, this last game, we played on Saturday when it was pouring rain. We still play in the rain, and it was a very dangerous game. We played against a team that plays pretty dirty. We knew that they play dirty. And the first 5 minutes of the game, I went to tackle one of the girls, and my teammate also came in to tackle her, and me and my teammate actually hit heads. So that's how I got the 11 stitches over here. And just wrapped it up. It was like bleeding everywhere, but they just wrapped it up and I kept playing. And then the last 10 minutes of the game, I actually went to tackle that same girl, and she decided, instead of like stiff arming or trying to get out of the tackle, she just cocked back and punched me right in my eye.
Okay.
So everything went black.
Which is legal in rugby.
Oh, illegal.
Oh, it's illegal?
You can't punch in rugby, no.
Oh, you can't punch people in the face?
You can stiff arm.
Okay.
Technically, you're not supposed to stiff arm in the face, but it does happen on accident. You just can't close fist or like extend.
But the injury was Saturday, because that's 2 days ago. Yesterday was Sunday, and you had some severe migraine symptoms.
Yeah, I don't know if it was like a slight concussion. I mean, I know I've had at least 1 or 2 slight concussions in college.
You had a headache.
No.
Did you get nauseous?
No nausea.
Did you have confusion?
Yeah, I was talking to my friend, and I kept saying it was Tuesday.
You're a little hasty.
And they were like, it's Sunday, and I'm like, I said Sunday, and they're like, you said Tuesday. I'm like, did I say Thursday? And it was just a weird conversation. I was like, wait, where is my brain at right now? I need to restart.
Okay. Yes, you have a mild concussion.
I figured.
And so, but you feel better today. You have not had that today. No headaches today, no sensitivity.
I literally laid in bed all day yesterday.
Okay, mild headache. All right, so yesterday when we spoke, you rested after that, you drank plenty of water. Did you get the coconut oil?
I didn't get the coconut oil.
Okay.
I didn't leave my house.
I thought only if you had coconut oil.
If I had it, yeah. Okay. I drank lots of water and like fresh fruits. Just kind of like kept it low key with my food yesterday, and literally just laid in bed and watched football.
All right, tell me about your spine before this rugby injury. Did you ever have neck pain or back pain?
Yeah, so I actually started going to different chiropractors before, but this was about maybe 9 years ago. My first like injury. I used to run track in high school, so I did hurdles as well. So my hip flexors are like pretty weak. So a lot of the times my hips become unaligned. So the first time that happened, it was about 9 years ago. I was actually lifting weights and like bench press, and for some reason my hip just decided to come out of place during that, and could barely walk. So my hips do come unaligned a lot, especially in rugby when I get tackled certain ways. So I do have to have that like fixed a lot.
Okay, very good. How much stretching do you do on your own?
Not like an excessive amount. When I go to the gym, I stretch, and afterwards I stretch too. Okay.
Any stretching on non-gym days?
When I'm at rugby practice.
Okay.
But not like if I'm just home, no.
All right, how old are you again?
27.
Oh, okay. Okay, you look fantastic. I thought you were like 22.
Yeah, I don't think so.
I was going to be like, okay, but 27, you're like right at that line where the body isn't magic anymore.
I know.
Like it's so magic before that. Yeah, okay. Okay, we definitely have a supination eversion happening on the left there. It is not bilateral. Go ahead and turn around, go the other way. The right side, not so much. There looks like a tiny bit of a bunion formation on the right hallux. Not sure if it's on the left. We're definitely seeing a collapsed arched bilaterally, maybe more on the left. But that left side, definitely, she's straightening it out because I'm talking about it, but there's definitely supination eversion happening there. And then we have bunion formation on both sides. Do they hurt, those bunions?
Not really.
Okay, cool. All right, turn around, keep walking again. All right, shoulder height looks pretty even from here. Can't really tell. Definitely have a high left ear on posterior. Yep, it comes back. There's a right head tilt, high left ear. Shoulders look pretty close together. Okay, you can stop right there. And then put your hands on top of your hips.
I thought you were going to say head.
Half a step back. Good right there. Okay, I'm going to put my fingers on top of your hips, okay?
Okay.
All right, let your hands drop. All right, we've got a high right hip. And turn around and face the other way. Okay, so the left shoulder is high. High left shoulder, high left ear, high left shoulder, high right hip. Good compensation there. Got some feet stuff. You need to get some arch supports for sure. Turn around and face me again. We need some arch supports. Okay, march in place. Just march right there. Okay, looking for hip rotations. I don't see anything. Looks like it's coming straight up and down from there. I'm not expecting any internal or external rotations of the hip. Okay, you can stop there. All right, nice and gentle breathing. Let's take a look at the spine. Let's see what's happening in here. It's very symmetrical. You actually are very symmetrical. The tone is very succinct, and the temperature is even throughout the spine. I mean, there's a little bit of increased warmth, but it's just from the top to the bottom. So we're gonna have to really come up to the top here. We've got one spot right here. It's like just dead cold. It's like warm, 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 warm fish. Warm again, but less so in the neck. Okay, we have a lot of upper cervical diagnosis to do. We need to really make sure we get a good adjustment in the upper cervical spine. I mean, I always do, but especially after a head injury. Okay, I'm going to palpate the SI joints, okay?
Mm-hmm.
Do you have any pain, tenderness, discomfort here?
Nope.
Do you have any pain, tenderness, discomfort here?
A little bit, actually, now that you're doing that.
Lower right SI here.
Mm.
Here.
Yeah.
So the most is right here.
Yeah, it's usually on that side, too.
Okay, what about in here?
Mm-mm.
L5, L4 here.
Mm-mm.
L3 here.
A little bit.
L2 here.
Mm-mm.
Little muscle spasm there. Let's check. So we are, it's pretty accurate. It's 3 right there, too. We are still high on the left. All right, let's do this. I'm going to check for SI joint movement here. Bring your toes together even. All right, let's check for scoliosis first. Okay, you're going to bend forward and touch your toes. Go ahead, let your head relax. No rib humping. A little bit of an asymmetry on the left, but nice and straight spine. Go and stand back up. Okay, now checking for sacrum and ilium movement. Okay, I'm going to place my fingers on top of your hips, okay?
Mm-hmm.
Okay, first the left SI joint and the S2 tubercle. Okay, go ahead and bend forward, touch your toes. Okay, excellent movement there, back up. The left SI joint is moving nicely. Okay, now we're gonna do the right side, same thing. It moves there, but it's delayed. Go ahead and stand back up, and less restricted range of motion on the right. Looking for postural sway here, which indicates either fixation or hypermobility. Little bit of swing. It wants to go to the right, wants to go to the right. Good compensation. The body is definitely feeding it, fighting it. And then back to the left. A little bit forward there, but it's going to come back. It could go either way. Go ahead and open your eyes. Let me see. Can you touch your forearm to your thumb?
Oh.
If you go like inside like this. Pain?
A little.
Not quite. All right, we're going to look at the glute fibers here to test for pelvic rotation. Okay, you're going to feel my fingers on the back of your hamstrings, okay?
Mm-hmm.
Okay, we're lower on the right side here. And then looking from the top, this is slightly externally rotated on the right. The tonicity of the glutes feel even. Yeah, is this a tender over here?
No.
Mostly it's all happening on this right SI joint. And it is, what did I say? It's the lower side. So this is the posterior inferior. Okay. So nice, gentle breathing. Terrible?
Mm-mm.
I'm going to put some magnesium spray on your back, okay?
Oh.
Magnesium is good for the muscles. Many other things too. And so our intention here is pretty simple. We're going to alleviate some of this neck tension that you have up here. Do some more cranial. Try to help settle out this concussion. Okay, nice and gentle. We're going to start in the middle of the spine here. That guy. All right, so you've done this before, but as you breathe out, I'm going to follow that breath, and then at the end, we'll give a little push, okay?
Mm-hmm.
Let's give it a try. Deep breath in and out. Shoulders relaxing. Okay, nice gentle breathing. Good. We're gonna try one more time. Shoulders sinking. Yeah, it doesn't work when you're tense. Let's gotta let it go more. Let the shoulders go more.
Ooh.
Better. All right, let's try this one now. Go and take a deep breath in far in as you can. Let your shoulders relax as you can. Okay, let's check the coccyx fibers here. Do you have any tenderness here?
Mm-mm.
Any tenderness here?
Nope.
Good. So let's do this. Go and lift your right leg in the air. Put it down, put it down. Whole thing, don't bend the knee.
Oh.
Okay, go down. Left. Down. Right. Down. Which one's more difficult?
I don't know. I wasn't really thinking. Probably the right a little bit.
Okay, any tenderness here?
Mm-mm.
Okay, let's do this. Go and take a deep breath in and out. Okay, we're going to bring the hip down a little bit more. Shoulders relax. Good. That's very nice. Good. One more breath. Good. Turn your back. How's that?
Great.
All right, let's see what's happening here in this SI joint. Okay, you're going to take a deep breath in. Shoulders are going to come up like this. Good. I'm going to bring the hip down. Good. Shoulders. Good. Lay on your back.
Can't help but make noise afterwards.
Good. Okay, turn your head to the right. Back to center. Left. Center. Bring your right ear down to your shoulder. Center. Left ear. Center. Alrighty. I'm going to put some medicine on your face, okay?
Okay.
We're going to do some nice gentle traction. you have to do is breathe. Pay attention to the sensations of your breathing. Very gently, just feeling the spine here. Crack your own neck?
Not really.
Right there. Okay, now let the head and shoulders just kind of sink in. Very good. Okay, you're breathing. As you breathe out, we're going to follow your breath. Gently push in that direction, okay? Cool. Okay, one more breath. We'll follow the next one out. Good. Shoulders and hips. Let it all go.
Ooh. That's crazy. My neck feels longer. Just like instantly feels like longer.
Space. Nice, gentle breathing. Same thing. We're going to do the right side here. Look at the atlas. We're going to bring this over to the side. Very gentle little push like that, okay? Good. Shoulders and hips.
It's crazy.
Nice and gentle, let it relax, don't help. Oh. Okay, squeeze my fist in between your knees. Squeeze. Did you feel it? Didn't crack in your pubic bone? Squeeze harder. Okay, relax. Push your knees out to the side. Push hard as you can, hard as you can, hard as you can. Push, 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 push. Relax. Okay, hold your knees together. Hold them. Hold it hard as you can.
I'm trying.
Relax now. Squeeze again, hard as you can. Hard as you can. Okay, relax. It's fine. Okay, look at me. You're fine. Okay.
I can't stop my body shaking. I don't know.
Okay, let's do this. I'm going to show you what it's like so that way you don't have to be nervous. I'm going to use this towel around your neck, okay? Okay with that? Okay, I'm going to follow your breath just like the other adjustments. As you breathe out, we're going to follow in this direction like that, and at the end we give a pull in that direction, okay?
Okay.
Alright, we're going to do it gentle today. You don't need a huge one, we need to clear out the rest of your spine.
Okay.
Let's give it a try. All you have to do is keep your teeth together. I'm going to follow your breath. Go ahead, in breath. Following this one out. Very nice.
I felt the decompression.
Did you feel it all the way down?
I felt it down there, yeah. Oh God.
That's good. Good. Push this back against me here. Push. Push harder. Okay. Push here.
Oh, that was weird.
Bring your chin down to your chest. I'm going to reach around the front and hold on to your elbow, okay? Let this relax here. Let this relax. Relax. Push this one back again. Push. Push.
Where was that even cracking at? My shoulder?
Yeah, it's the acromioclavicular joint. So the clavicle comes up right here, attaches to the acromion process of the scapula. Okay, you're going to make a full recovery after this.
I hope so. Until I play rugby again.
Cool. Is there anything else that you want me to look at or work on?
No, I feel great.
All right, lots of water. Ashwagandha really is probably one of the best herbs that you can take if you wanted to. But I think that you're just going to feel better after this. Yeah.
I already do.